All
Thank you,
yours.
Sue. Thank you very much. And thank you for inviting me again to contribute. Thank you to Wendy for your session. I was fascinated actually because, in fact, the points that are used for sterile water injections are actually very similar to the points that can be used for acupuncture for pain relief in labour. So it's not only based on the neurological pathways, but it's actually some points that relate to an energy line used in acupuncture that flows through the uterus and therefore contributes to reduction of pain in labour in that way. So they are very, very similar, but they're slightly different mechanisms, but it's the same sort of points. So thank you very much for asking me. And this time I've chosen to talk about safety of complementary therapies to a certain extent, because we are having a lot of national scrutiny at the moment from a variety of sources, CQC, the Ockenden review teams, and parents support groups that evolved from Morecambe Bay issues and this sort of thing. And there's been a lot of media coverage, public media coverage of how awful complementary therapies are. Now, I wouldn't have been working in this field for 40 years if I didn't think there was some benefit to it. And I think we have to start with looking at how valuable complementary therapies can be. By complementary therapies, we mean anything that is outside of mainstream healthcare, maternity care in our situation. And that can be used alongside it. And I don't talk about alternative therapies. I do definitely talk about complementary therapies, because certainly in maternity care, they should be used alongside any conventional midwifery or obstetric care and management that's included for individuals. So we're looking at things that may be supportive therapies, aspects like massage or aromatherapy, reflexology. We're looking at therapies which may address specific issues. So acupuncture, for example, can be very effective for nausea and vomiting in the first trimester, certainly for pain relief in labour. Clinical hypnosis. I'm not talking about hypnobirthing, because hypnobirthing isn't technically classified as a complementary therapy in the complementary therapy world. Of course, it is a complement to our care, but there's a fine differentiation there. But clinical hypnotherapy can be useful for dealing with those women who have tocophobia, fear of labour, or needle phobia, preparation for birth. And I think this is where we can start using the complementary therapies as midwives, but we also have to remember that a lot of parents will use elements of complementary therapy or perhaps natural remedies during their pregnancies. Indeed, some use natural remedies to help them get pregnant, especially if they've had difficulties in conceiving. But it can be quite difficult because we don't always know that parents are using various therapies, natural remedies. They may be self-administering aromatherapy oils at home, putting them in the bath or whatever. They may be deciding to try raspberry leaf tea to prepare for birth. They may be using ginger as a solution to their nausea and vomiting. And sometimes it isn't appropriate and sometimes it isn't safe. So I think we have to be able to help them. Now, I have long said that the Nursing and Midwifery Council in the UK should be encouraging training of pre-registration midwives and certainly post-registration midwives, not necessarily to get involved and to practice different therapies, but we ought to all be able to advise parents, ask them questions, or if they ask us questions, to answer them, because often the parents are doing these things and they're not telling us. Perhaps they don't feel we need to know. Maybe they think we'll be a bit skeptical or whatever. Actually, we do need to know. And especially when it comes to elements like aromatherapy, where we've got chemical, pharmacologically active oils, or when people are using natural remedies. So they're perhaps taking St. John's wort for as an alternative to antidepressants. And yet, St. John's wort works exactly the same way as selective serotonin reuptake inhibitors, and therefore you can't take them together because you have a greater risk of side effects. So there's lots of things that I think parents are doing, but they're also wanting something to help them as they get to the third trimester. They're looking to prepare for birth, and they are perhaps bringing their own remedies in. And many of you may have been faced with parents who bring in oils, or they have homeopathic remedies which don't work the same as herbal ones, or they may occasionally be accompanied by a doula or a therapist who's doing some reflexology or something like that. There is no doubt that complementary therapies, when used properly, effectively, appropriately, can be an extremely good adjunct to the care that we're providing as midwives. So if you use them through certainly the last trimester of pregnancy, there is evidence to show that it will facilitate physiological birth at a very, very basic level. Most therapies are relaxing. And if you can reduce the stress hormones, the cortisol and what have you, then obviously you're going to help release of oxytocin, because cortisol suppresses oxytocin. You're going to enable parents to cope better with the discomforts that they do have. And we can use these different therapies and remedies either before labour, or even to aid the onset and progress of labour, and then during the first stage of labour as well. And in so doing, then hopefully we're going to have an impact on reducing these huge, horrendous, in my opinion, levels of intervention which we've currently got in many units. I'm working with a maternity unit at the moment where they have a 60% induction of labour rate. And, you know, the midwives are horrified by it, and they just don't know how best to tackle it. So we're looking at bringing in aromatherapy. We're looking at setting up a post-date pregnancy clinic using acupressure, and a variety of other things. So it's really useful in reducing intervention, and there is evidence to show that too, both in the UK and in some overseas countries. I think also it's about enabling midwives to get back to that nurturing that is fundamentally a part of midwifery. And that helps to improve parents' experiences of birth. It makes them feel that they've had a more satisfying experience, even if occasionally things do go a little off the normality spectrum. They can cope with it better because they feel nurtured and cared for. And at a managerial level, there is evidence to show a real cost saving if you can reduce that cascade of intervention. And if you look at the cost of a cesarean, which I think is somewhere around £7,000 or something now, Wendy might be able to correct me on that. But, you know, if you can encourage a more spontaneous vaginal birth, then not only is that better in the long term for the woman, but it's also a great deal better for the institution, the unit. And by doing that and improving parent satisfaction, you've then potentially got a reduction in the risk of litigation, where small things might have gone wrong. I'm not talking about the major complications, but small things might have gone wrong, and parents look for ways to get apologies and things like that. So there really are some benefits. However, we have to set what we're doing as midwives in the context of the place in which we work. And if you're in the UK, then obviously we have a great deal of rules and regulations and directives which we have to follow. I have to say, NICE, the National Institute for Health and Care Excellence, is not particularly enamoured of complementary therapies across the board, not just in maternity care. But as you probably know, the intrapartum guideline was revised and was published in, I think, September of this year. They haven't changed a great deal from the last one when it comes to mentioning complementary therapies. And they say, well, it's okay. They can have breathing exercises. They can have immersion in water, in a pool. They can have massage. Strangely, they say we should support parents' wishes. If the woman wants to have massage that's been taught to her companion, but they say we're not supposed to be offering it. Now, that doesn't actually make much sense, because either massage is safe or it isn't. And if it's safe, it probably doesn't matter who does it. They're also saying we shouldn't be offering or advising aromatherapy, yoga, acupressure, either in the latent phase of labour or in the established first stage, and they go on to look at acupuncture, acupressure, and hypnosis. But the problem that NICE has is that they don't know where the evidence is. So they tend to say, well, there's no evidence, or there's very little evidence, or it's not very robust evidence, because randomized controlled trial methodology does not fit with complementary therapies, where by definition it should be holistic for the individual, and it should be individualized according to what they want and need, and it's appropriate for them. So we've got a real problem when it comes to research, and it's easy for people to say there's no evidence. There is, but it's a bit difficult to find. And then, as I said earlier, we have issues particularly around aromatherapy. There have been a couple of cases in units which are being investigated by the Ockenden teams. And I'm not here saying anything that is outside of the public domain. There have been some inquiries about midwives not getting medical support because they've been wondering about using aromatherapy and this sort of thing. And, it's alleged, but it really sort of undermines what people are doing when they're using complementary therapies in their own practice. If we're using them, we have to make sure not only that we use aromatherapy or any other therapy in conjunction with our midwifery regulation. So in the UK, that's the NMC code, the standards for practice. We obviously need to have indemnity insurance, we know that. And when it's something like aromatherapy, it has to be in line with medicines management principles. They are not medicines, but they act like medicines. So they're full of chemicals, the oils, but you still have to use the same sort of principles. We also have to set our therapies in the context of the organisation in which we work. So with things like acupuncture and essential oils, anything that we are physically doing has to fit in with health and safety regulations. For oils, it's controls that the control of substances hazardous to health, and even after Brexit, something called the cosmetics regulations, which sounds a bit odd because they're not cosmetics, but there's nowhere else to put essential oils. So some of the regulation of aromatherapy comes under the cosmetics regulations. Now, I think one of the issues that is occurring is that midwives who practice around complementary therapies, whatever it might be, reflexology or anything else, tend to get very, very enthusiastic, and that's fantastic. We want them to be enthusiastic, those who wish to be involved in using their therapies. But you have to recognise when it's appropriate and when it's not. And basically, parents who can have complementary therapies, either in pregnancy or in labour, will be those who have obviously given informed consent, but those who have no medical or obstetric contraindications, conditions. It is not appropriate at all to be using any complementary therapies for women who have complications from pre-existing medical conditions or from obstetric conditions. And that is where some of the concern in the public eye has come from. On the whole, if you look at saying, well, those women who are eligible for a birth centre birth or a home birth are the ones who may be eligible to receive complementary therapies. Has to be obviously in conjunction with whatever else is is being done, and the NMC code says that your therapists have to be compatible with any other care. But you have to really eliminate those people who are not eligible to use complementary therapies at all. So depending a little bit on the individual therapy, it would not be appropriate to use aromatherapy oils on the antenatal ward or the triage area, because by definition, some of those women will have potential complications. I've put main delivery suite in brackets here because, of course, occasionally we may have women who would have had a birth centre birth, but maybe the birth centre has been closed for whatever reason. And so we're still looking at parents whose medical and obstetric conditions are within normal physiological parameters. There are definitely some medical conditions which totally preclude the use of any of the complementary therapies, really. But then, you know, sometimes you're looking at liver disease. If somebody has liver disease or obstetric cholestasis, they wouldn't be eligible to receive aromatherapy because the oils are metabolized via the liver. But they may also not be eligible to receive reflexology because it is possible to overstimulate the liver by working on specific foot points that correspond to the liver zones. With acupuncture, you can't use acupuncture for anybody who is on anticoagulants, and that causes us a bit of an issue because so many women are on prophylactic aspirin or enoxaparin, and yet because you are inserting a needle, which is invasive, you have to be extremely cautious. You need to be cautious with therapies like aromatherapy oils, which will affect everybody in the room, because the babies would not be eligible to inhale those vapors. If you can smell the vapors, the aromatic vapors, you are actually inhaling the chemicals. You have to be careful. And I think the watchword has to be, if in doubt, leave it out, is my motto. If in doubt, don't use anything until you've maybe checked it. Or if you have any reason to be concerned, whether it's intuitive or after an assessment, then it may not be appropriate for some people to receive those therapies. It does depend a little bit on the individual therapies, but as a general rule, you would only want to work with those who are within physiological parameters. So what do you need to know if you want to be involved in either using complementary therapies, especially the manual ones, in your own practice, or if you don't want to be involved or you're not in a position to be practicing a therapy particularly, then what advice might you need to, what information might you need in order to advise parents appropriately and safely? Obviously, you need to know who can have the therapy and who can't, for whatever reason. You need to understand how it works and how you use it. So that will be the actual practice of each therapy. For example, there are some acupuncture points which, if you put the needles in at the wrong angle, can cause complications. So you'd have to know what you were doing, and you'd have to have understood the underpinning theory of the therapy before practicing it. And of course, you have to do it within the guidelines. You've got to have clinical guidelines that are ratified and updated regularly, so that the trust, if you're working in the NHS, will then cover you by its vicarious liability to do that. What we don't want is a maverick but very enthusiastic midwife doing her own thing. And I'm afraid we do get that a little bit with reflexology, where it's very easy just to tweak a little toe or something and think you're doing perhaps something to manage a retained placenta. But if you haven't got a guideline to follow you, and support you, you haven't actually got the support of your managers and protection under the guidelines. So it's really important to get that right before you carry on with what you want to do. Like any other intervention, you need to understand what happens if you don't use it appropriately, what relatively normal in inverted commas, side effects might be, and what complications there are, and how to minimize those risks, but also how to recognize whether it's a complication of the therapy or something else going on with the pregnancy or the labor. I think it's important also to be able to advise parents accordingly. So raspberry leaf tea is probably one of the most common questions that parents ask, or one of the most common remedies that they use. And sometimes midwives can advise. Sometimes they give a little bit of information that's not wrong, but it's slightly wrong by omission. They haven't given complete information. And I think that's quite important too. And this is what I think the sort of thing that should be included in pre-registration midwifery. So you have to understand how to apply the principles of the therapy to your practice within midwifery, whether it's pregnancy or birth care, and how the use of that therapy by midwives fits into the institution in which you're working. And of course, then there's the evidence base. Yes, I've said that it's a bit variable, but there is some evidence there. It's not always good. I have to say that. It's not always good, but there is evidence there to support you if you know where to look for it. So that's a brief run through. And I mean, it is a vast subject. Complementary therapies is not just one thing, it's lots of different therapies. And your interest may focus on one particular therapy, but I do also think that midwives need an understanding, a question and answer type of understanding, so they can advise parents